Michigan Health Council is a nonprofit located in Okemos, Michigan.
Hello, I'm Melanie Brim, President and CEO of Michigan Health Council. Michigan Health Council was founded in 1943 by the Michigan State Medical Society, Michigan Hospital Association, and Blue Cross Blue Shield of Michigan.
MHC's vision is for every person to have access to the right team of healthcare professionals to meet their health needs. MHC works to achieve that vision by creating products and providing services that help to build healthcare workforce capacity.
When I think about capacity, it's certainly one of the first places one tends to think about is that we have enough healthcare providers. But that's also, it's a lot bigger than that. It means we're talking about providers who are able to provide culturally competent care. It's providers who recognize the importance of understanding issues like health literacy or the impact of social determinants of health on individual patient outcomes. Our vision is that every person has access to the right team of healthcare professionals to meet their needs, and that means that we have to have a workforce that has the capacity to do that.
Michigan Health Council reaches beyond Michigan.
While our name is Michigan Health Council, we actually go by MHC because our work extends far beyond the boundaries of Michigan. We do work in Georgia, we do work in Ohio. I currently have a student that I'm doing work with in China. So we view our role as supporting any place in around our country, around the world, who can benefit from the use of our products and services.
At Michigan Health Council, we inform, connect, and create.
One of the roles that we have is to help make sure that individuals, organizations have the kinds of information they need to have to make appropriate decisions about the workforce and about healthcare. We do that by conducting research, producing reports, white papers, sharing our knowledge so that others can make decisions using good, solid data and information. One of the things that MHC is really strong at doing is bringing people together to have conversations. We, for example, have our Social Determinants of Health Partnership, which is a group of individuals who came together to talk about the things that impact health equity. We provide user group meetings for people who participate in our ACEMAP program. Whenever possible, we find topics that are of interest to people and then convene people around that. Going back to our mission statement, we talk about creating innovative solutions that help our partner organizations to achieve their mission.
Michigan Health Council works across the healthcare spectrum, from pipeline to retirement.
When we think about having an adequate workforce in terms of numbers of people, we think about the pipeline of students headed towards health careers. So one of the things we know is that to interest people into going into health careers, we've got to start sooner than later. One of the ways of addressing healthcare workforce supply issues for the long term is working on developing a pipeline of students into the health careers. And we know that we really have to start doing that earlier than college. We have to start doing that earlier than high school. And so that's a really important thing to us, to really think about how do we start as early as we can, interesting kids into going into health careers. We also know that working on pipeline or pathway programs for students is also one strategy for also improving the diversity of the workforce. For us, it's an important part of our work is figuring out how to interest young people to pursue careers in healthcare. We do that through a number of pipeline programs.
Mini medical school.
One of the most exciting programs I think we have is our mini medical school program. This is a program for students in kindergarten through 5th grade to introduce them to health careers, to concepts of health and wellness, to build aspirational thinking about what it is possible for them to achieve. We focus on going to schools that are in underserved urban and rural areas, schools where students are less likely to have had an opportunity to be exposed to some of that information. Our hope is to build from that a diverse pipeline of students who go on to pursue a career in healthcare.
Fit for Success.
So our mini medical school program has been incredibly successful, and we recognize the need to move on to the next level, which was to move into the middle school, and are in the process of developing a program called Fit for Success. We started initially with publishing a magazine that we've distributed, and over the next couple of years we'll be building that out to take similar kinds of information to middle school students.
HOSA.
Our HOSA program, which is for high school kids and more recently middle school kids, is part of a national program to interest students in health careers as a future. It provides opportunities for leadership development, learning of some basic healthcare skills such as CPR, and students get an opportunity to work on developing those skills and then competing in regional, state, and national competition.
AceMap.
AceMap is our technology platform solution, provides services to academic institutions and healthcare systems to manage clinical placements as part of the education process. We also provide career matching services through it. We offer a mentoring program through the AceMap platform, and we also are building a library of resources for healthcare professionals to be able to access that will be housed on the platform.
Michigan Health Council works with most healthcare professions, including nursing, primary care physicians, pharmacy, and social work.
We recognize the importance of primary care as the underpinning for healthcare, critical to addressing issues of health disparities, health outcomes. So we do a little work in that area. Currently, we have two projects going on. One of them is managing the MyDocs Consortium, which is an initiative in the state with 4 of our medical schools to increase the number of residency slots, specifically around primary care specialties, with engagement with underserved rural and urban communities. So PCPMI stands for Primary Care Partners Michigan. It's a network that we're building of individuals, organizations who are interested in primary care. It's a way for that network to come together, to have opportunities for education, to network among themselves, to talk about strategies to address issues that are important to primary care, and for MHC to identify ways that we can support the primary care workforce. Since 2002, we have been home to the Michigan Center for Nursing. It is an online resource with lots of information to help support nursing, information on nursing career paths, scholarships, different educational opportunities that are available. The Center for Nursing is also the host of the annual Nursing Summit that is held every October, where we bring together several hundred nurses, focus on issues that are of significance to the nursing profession. In addition to the Center for Nursing, we are also home to the Michigan Nursing Action Coalition, working on addressing the issues that impact the future of nursing in America. Nursing education, nursing practice, leadership, diversity in the workforce, nursing data and interprofessional collaborations. Nursing and non-nursing come together to work on projects that are designed to address some of the challenges facing nursing in the future. Currently, we have projects such as nursing workforce diversity, nursing on board leadership, and health equity.
MHC can help your organization serve your patients and partners through our digital content.
Also host a site, Michigan Center for Caring, which is a place for resources for providers, patients, and caregivers on all aspects of aging. A couple of years ago, we recognized that increasingly as the aging population grew, that the lack of geriatric specialists continued to exist, that more primary care physicians were going to have to deal with issues with aging. And so we wanted to provide a platform for them to be able to learn more about the unique challenges of dealing with an aging population. Addressing issues related to or connected to health equity are also of importance to us, and most recently we've put together a series of videos on implicit bias. We have available online videos, a general overview of implicit bias, one that focuses on race, and one that focuses on poverty. We're also building out some additional modules that will come out in the near future. One of the most exciting projects we have going on right now is a grant we received through the Michigan Health Endowment Fund. We are working on improving health literacy for patients who are diabetic in terms of managing their medication. But we're focused on it in a more unique way. We're focused on educating providers about how to address issues of health literacy with their patients, learning to understand how better to communicate, first of all, to identify that they have patients who may be dealing with literacy issues, how to deal with the stigma of that, how to learn to communicate more effectively with it so that patient outcomes improve.
MHC also provides consulting services like capacity building, strategic planning, research and data services, program development, grants management, and association management. Thank you for taking the time to learn more about Michigan Health Council. We look forward to working with you.